This last section, let us talk about the development of the tongue. We'll also look at a development of the thyroid gland also, and we'll also talk about some important ocular derivatives. You got a lot of questions on that ocular derivatives. So starting with the development of tongue first. Well, to understand the development of tongue, we have to look at the pharyngeal arches of both sides simultaneously. And going back to the very first thing we said, that pharyngeal arches of both sides, they will come and they fuse in the midline. So we have first pharyngeal arch, second, third, fourth arch. They are all fusing in the midline. And let us imagine we are looking at that arrangement from the posterior side. Like if I'm looking at my own pharyngeal arches like this. So I'll be looking at the endodermal part which is inside, ectodermal part which is outside here. So we got to consider the pharyngeal arches of the both sides in this image. Let us say this is the first, second, third, fourth and the sixth arch. And same here, this is the first, second, third, fourth and the sixth arch. So we're looking at the pharyngeal arches of both sides simultaneously. So that's a view from the posterior side. Pharyngeal arches of the right and left side, that's what we said, they are going to fuse in the midline. Let's say this is a midline here. So if this is the first pharyngeal arch, that will fuse with the first one of the opposite side. Here is the second pharyngeal arch. Third arch. There is a fourth one, and here we got the sixth pharyngeal arch. Right, so you're looking at the pharyngeal arches fusing, going ventrally and fusing in the midline, and you're seeing it from the back. In the mesoderm of the first pharyngeal arch, and please mind the word I'm saying, in the mesoderm of the first pharyngeal arch, not ectoderm, endoderm, you can see these elevations on the inside, but that doesn't mean these swellings are made up of that endodermal or ectodermal structures. These are the mesodermal swellings, and this mesodermal swelling is called as the lingual swellings. These are the lingual swellings. Let me just highlight this part. Let us say these are the lingual swellings here. As the name suggests, obviously will contribute something in the development of tongue. Between these two lingual swelling, at the midline there is another swelling which is also mesodermal. I'm writing it on the opposite side. This is called as tuberculum impar. This one is called as tuberculum impar. In the final picture, the tuberculum impar is not important because lingual swellings and this tuberculum impar is there, but this tuberculum impar actually will be overridden by something else. So you will have something else which will override this tuberculum impar. So when we talk about the overall development of tongue, the contribution of the tuberculum impar is not much. There is also an endodermal opening there which is called as the foramen cecum, that is the future foramen cecum of the tongue, which will be here. I mean, right now it is the point from where the thyroid gland will develop. We'll discuss that in a minute. And guys, look at this. At the ventral aspect of the third arch and the fourth arch, let's pay attention to this. Ventral aspect of the third and the fourth arch. And again, there's a mesodermal swelling. I'm saying it again, that's a mesodermal swelling. This mesodermal swelling at the ventral aspect of the third and the fourth arch, this is called as the hypobranchial eminence. This is referred as the hypobranchial eminence. Let's go with some color codes that will make it a bit easier for us. That is hypobranchial eminence. So when we talk about the development of tongue, what is important here is the lingual swelling and hypobranchial eminence. Forget about the tuberculum impar. Because, so as we know, conventionally we divide the tongue into anterior 2/3 and posterior 1/3. So guys, let us say if this here is the anterior 2/3 of the tongue, that is a sulcus, right? And here is the posterior 1/3 of the tongue. And these are circumvallate papillae which are situated on the most posterior side of the anterior 2/3. So this is the anterior 2/3 of the tongue. Here we got the circumvallate papillae, and this is the posterior 1/3 of the tongue. Lingual swellings, which are a mesodermal swelling in the first pharyngeal arch. Now these lingual swellings will give rise to the anterior 2/3 of tongue, but except circumvallate papillae. Look at that. And this makes perfect sense. I mean, lingual swelling will give rise to the anterior 2/3 of tongue except circumvallate papillae. How does it make sense? Anterior 2/3 of tongue is derived from lingual swelling, and lingual swelling is present in first arch. What are the two nerves supplying the first arch? Remember, post-traumatic nerve and pre-traumatic nerve. First arch is supplied by the mandibular nerve as well as the cauda tympani nerve. And if you look at the anterior 2/3 of tongue, the nerve supplied to the anterior 2/3 of tongue is again the same. General sensation is by mandibular nerve, or you can say that is lingual, and the taste sensation is by cauda tympani. So from the nerve supply point of view also, it makes perfect sense that the anterior 2/3 of tongue is derived from the lingual swelling of the first arch, and the first arch is supplied by two nerves. One is carrying the general sensation and one is carrying the taste sensation from the anterior 2/3 of tongue. Hypobranchial eminence. Now what you need to understand in the hypobranchial eminence is present in two arches. You can say it is present in third arch as well as in fourth arch. Let's say this is the entire hypobranchial eminence that is present in third arch and the fourth arch. And see, again, it's very logical. Third and fourth arch, guys. What is the nerve supply for third arch? It's glossopharyngeal nerve. And the nerve supply for fourth arch is what? Vagus nerve. But when you talk about the posterior 1/3 of tongue nerve supply, it is not vagus nerve, it is glossopharyngeal nerve only. That means not the entire hypobranchial eminence, only the cranial part of hypobranchial, this much. Only the cranial part of hypobranchial eminence will give rise to posterior 1/3 of tongue, because the nerve supply is glossopharyngeal nerve. So this is the cranial part of hypobranchial eminence, and that will contribute to the posterior 1/3 of the tongue as well as circumvallate papillae, which are in the anterior 2/3. So cranial part of hypobranchial eminence will contribute to the posterior 1/3 of tongue as well as circumvallate papillae. General sensation of the posterior 1/3 of tongue is by what now? Glossopharyngeal nerve. And even the taste sensation coming from this part, the one we highlighted in blue, is also glossopharyngeal nerve. And glossopharyngeal nerve is a nerve of third arch. In the third arch, we have cranial part of hypobranchial eminence. And then finally, guys, what about this remaining part, the caudal part? This caudal part of the hypobranchial eminence will give rise to what? Now again, think about it. What is behind the tongue? Just behind the tongue is what? Epiglottis. So epiglottis is derived from this caudal part of hypobranchial eminence. Epiglottis is by the caudal part of hypobranchial eminence, which makes sense in a way as well. We know that epiglottis, we just said, guys, laryngeal cartilages are derived from what arch? Fourth arch. And caudal part of hypobranchial eminence is in what arch only? Fourth arch. Again, from the nerve supply point of view, I mean, embryology, this makes sense in every possible way. Caudal part of hypobranchial eminence, just think about it once again, guys. Caudal part of hypobranchial eminence is in what arch? That is in what arch? That is in the fourth arch. What is the nerve supply for fourth arch? The nerve supply of fourth arch is a branch of vagus. That is what? Superior laryngeal nerve. And one of the branch of superior laryngeal nerve is called as internal laryngeal nerve, isn't it? One of the branch of superior laryngeal nerve is internal laryngeal nerve, which supplies the mucosa of the larynx above vocal cord. And obviously epiglottis is present above the vocal cord only. So whatever mucosa is covering the epiglottis, that is supplied by the internal laryngeal nerve, which is a branch of superior laryngeal nerve, which is a nerve of the fourth arch only. So this makes complete sense when you look at the nerve supply of that particular pharyngeal arch and what structure is derived from that arch. But one important thing to note in the tongue is, we said anterior 2/3 of tongue, okay, one by lingual swelling, posterior 1/3 is by this hypobranchial eminence and all. What about the lining epithelium, guys? Lining epithelium of anterior 2/3 of tongue or posterior 1/3 of tongue, or even behind in the upper border of epiglottis, we know that everything in oral cavity, whether it is tongue or palate or tonsil or the vallicula, the lining epithelium is stratified squamous epithelium. That is there. But think about it. Stratified squamous epithelium is the one which covers the entire tongue, whether it is anterior 2/3 or posterior 1/3. But will there be any developmental difference between the lining epithelium of anterior 2/3 of tongue and posterior 1/3? Yes, there will be. And what that difference is, if I remind you of something we discussed in the beginning only, that what was very special about the first arch? First arch is the only arch which is covered with what? Ectoderm on both sides. Let me just put it on this picture. What I'm trying to say, first arch is covered with the ectoderm on both sides. Let us say this is the ectoderm, so you'll see first arch is covered with the ectoderm on both sides. Whereas the other pharyngeal arches, they are covered with the endoderm from the arch below. That means the lingual swelling is a mesodermal swelling that is forming the core of the tongue. But first arch is covered with the ectoderm. That is why the lining epithelium of anterior 2/3 of tongue. If I talk about the lining epithelium of anterior 2/3 of tongue, that has to be ectodermal. Lining epithelium of anterior 2/3 of tongue is ectodermal because first arch is covered with the ectoderm. Whereas the rest other pharyngeal arches are covered with the endoderm. So the posterior 1/3 of the tongue, the lining epithelium is a usual endodermal which is there inside all the pharyngeal arches. So there's something very unique about this lining epithelium of tongue, that anterior 2/3 is ectodermal and posterior 1/3 is endodermal. That's because the first arch is covered with ectoderm on each side. What about muscles of tongue? Where the tongue muscles are derived from? We're done with the core, that is connective tissue part. We're done with the anterior 2/3, posterior 1/3 lining epithelium. What about the muscles of tongue? Muscles of tongue, if you remember something we discussed very much in the beginning only, we said extraocular muscle and tongue muscles, they are not derived from pharyngeal arches. They are derived from what? They are derived from the somites. And those somites are nothing but the occipital somites. So guys, even the muscles of tongue, they are derived from the occipital somites are giving rise to the tongue muscle, except which one? Again, except part is always important. Except which muscle? Except palatoglossus. Except palatoglossus, which again should make sense because palatoglossus is not only the muscle of tongue, it is a muscle of palate also. And what we just discussed in the pharyngeal arch, that the muscles of palate are derived from the fourth pharyngeal arch. So guys, all muscles of tongue, the genioglossus, the hyoglossus, the styloglossus, they are all derived from where? Occipital somite. But not the palatoglossus. It is derived from the fourth pharyngeal arch. It is from the mesenchyme of the fourth pharyngeal arch. So this is about the development of the tongue. Now let us also talk about the development of the thyroid gland. Now we have a duct called as a thyroglossal duct, which will developing from this foramen which is present just behind the tuberculum impar. Let me just take that part separately so that it will become a bit easier for us. So for the thyroid development, well, nothing much in that. Here is the first arch. That is a ventral aspect of the first arch here. And the second, so on. So we said there is a lingual swelling. We already talked about that. Lingual swelling is there. And then we have this tuberculum impar. And just behind the tuberculum impar, you will see a duct which will descend downward. That duct is called as a thyroglossal duct, which will form these two extensions also, which will give rise to the lobes of thyroid. This duct is called as a thyroglossal duct. Thyroid gland is the first endocrine gland to develop. You should know that also. This is the first endocrine gland to develop. It is the first endocrine gland to develop, which is almost on the 24th day. 24th day after the fertilization, you will see the beginning of the thyroid gland development. On the 24th day after fertilization. Now this thyroglossal duct obviously will divide and give rise to the thyroid lobe also. That's the usual thing, that thyroglossal duct, which is an endodermal duct because it is coming from the region of the junction of the first and second pharyngeal arch from the inside. So it is obviously the endodermal duct. So thyroid gland is also endodermal. What is important here, that when the thyroid gland it is formed from the foramen cecum part, which is on the junction of anterior 2/3 and posterior 1/3 of tongue, then thyroid gland is descending downward with the mean of this this thyroglossal duct, and will reach the anterior part of the neck here in the anterior triangle. But when the thyroid gland descends downward, you may have the remnant of this thyroglossal duct at the place called as a thyroglossal cyst. So the question asked here is that what are the common site for the thyroglossal cyst? If the question is asked that ectopic thyroid, what is the most common ectopic thyroid tissue? What is the location of more common ectopic thyroid tissue? That is a different question. And if the question is on the thyroglossal cyst location, that is a different question. So first of all, please note that ectopic thyroid tissue, well, even thyroid tissue can be present anywhere in the region from the tongue to this anterior part of the neck, but the most common site for the ectopic thyroid tissue is the lingual thyroid. That is a lingual thyroid. It is the lingual thyroid. But yes, if the question is asked that what is about the site for the thyroglossal cyst, that I need to tell you. Sites for thyroglossal cyst. Okay, for that, let us say if this here is the tongue, obviously that will be the site for the foramen cecum, that is a tongue. Here is the hyoid bone with this greater and the lesser cornua. There is the thyroid cartilage, thyroid and the cricoid cartilage, right? This is the final position of the thyroid gland. Thyroid gland, here it is. This is the final position of the thyroid gland. This is where the thyroid gland has to come. So what is the pathway? Let me give one stop here, that is above the or in front of the body of hyoid. One just up in front and below the body of hyoid. One stop in front of the thyroid cartilage, and this obviously is the final position. So these are the four sites where you can see the thyroglossal cyst. Look at this, the fourth site I'm highlighting here. The location is important here. The first site for the thyroglossal cyst, that is foramen cecum itself. The second site you're talking about is the one in front and above the body of hyoid. Number 3, that is in front and below the body of hyoid. And number 4, that is in front of the thyroid cartilage. And please note, out of these, this number 3 is the most common site. That is the most common site for the thyroid cyst, that is in front and just below the body of the thyroid gland. That is the thyroid cyst, thyroglossal cyst location. It is in front and below the body of hyoid bone. So this is about the development of the thyroid gland and also about the development of other structures. Now, before I finish off this head, neck and face development and move on to the next topic, let us also have a brief about the ocular derivatives. Now, in between few years, this question was asked like countless times. Like every paper was having at least one question about the ocular derivative. Although I personally believe this question is slightly saturated now, they've already asked this many times. But as I said, it is one of the most commonly asked question. So we should know about these ocular derivatives. So I'm not going into the detail of the development of the eye and everything. Let us see that what different part of the structures of the eyeball, they're derived from where. Especially the difference between the neuroectoderm and the ectoderm. So all that. So if I may just write all these ocular derivatives for you. That is ocular derivatives. So what we'll do, we'll write the embryonic structures and then we'll see what ocular derivative will be derived from here. So starting from the neuroectoderm, and I'll highlight the important one also for you. So starting with the neuroectoderm, the neural tube was formed in the neuroectoderm from that. Now neuroectoderm will give rise to the retina. It will give rise to the pupillary muscle, sphincter pupillae, dilator pupillae, the pupillary muscle. It will also give rise to the ciliary body epithelium. It gives rise to the optic nerve, optic tract, and even optic chiasma. Optic nerve, optic tract, and optic chiasma. And most of it, we have already talked about it. Remember, when we said that retina is derived from the diencephalon. In the neuroanatomy, we said the diencephalon will form the optic stalk. And that optic stalk will give rise to what? It will give rise to the optic tract, it will give rise to the optic chiasma, optic nerve, and even retina also. They are all derived from the optic stalk. Optic stalk coming from diencephalon. Diencephalon is formed from the neuroectoderm only. And this also we talked about in the general embryology when we said there are some exceptions in the smooth muscle development, in which we wrote that dilator pupillae and sphincter pupillae. These are the exception muscle, right? So they are derived from where? They are derived from the neuroectoderm and they are not from the lateral plate mesoderm. So this is about the neuroectoderm. The second thing, that is surface ectoderm. That is surface ectoderm. What important structures are derived from the surface ectoderm? That will include the corneal epithelium. That will the corneal epithelium, lens, there is conjunctival epithelium, lacrimal gland. They are all coming from the surface ectoderm. So corneal epithelium, the lens, conjunctival epithelium, they are all derived from this. And not only lacrimal gland, even the tarsal glands. Even the tarsal glands are coming from the surface ectoderm. In which I would say the the important one to remember is, one is the corneal epithelium and the lens. They are the one that you should remember out of all these, the important one, right? And just to tell you about the gland, the glands, the lacrimal gland is ectodermal. It is coming from surface ectoderm. And if I talk about head and neck, even parotid gland is from the ectoderm only. That is also from surface ectoderm. All those submandibular, sublingual gland, thyroid gland, they are all endodermal glands. But when it comes to the lacrimal gland and the parotid gland, these also are two important glands, but they are not derived from endoderm. These are ectodermal glands. These are ectodermal glands. The third thing there is the mesoderm. That mesoderm will give rise to what? Mesoderm of the pharyngeal arch. Mesoderm will give rise to the ciliary body, stroma. Ciliary body stroma is coming from here. Sclera, choroid, and obviously extraocular muscles. Remember, extraocular tongue muscle, they are from the somites. Somite means mesoderm only. Extraocular muscles. So once again, the important thing out of this is the ciliary body stroma, the stroma of the ciliary body, and over extraocular muscles. All those extraocular muscles, they are derived from the mesoderm. And then comes the most important, from where the questions are maximum expected, that is neural crest cells. Will always been important. The neural crest cells will give rise to the corneal stroma. That will give rise to the corneal stroma, and it will also give rise to the ciliary muscles. Sphincter pupillae and dilator pupillae. The pupillary muscles are from where? From the from the neuroectoderm, but ciliary muscles are derived from this corneal, from the neural crest cells. That is important. Neural crest cells giving rise to corneal stroma and ciliary muscle. The one which I've highlighted out of all these are the most important, and the questions can be expected more from these regions here. So this is about the ocular derivatives, that where they're derived from. This, as I said, it's one of the very, very popularly asked question in a few years back. Although the intensity of this question has slightly gone down, but you never know. So let me just finish off this head, neck and face development by finally telling you about one last thing, that is, they are also asked one question from here, that what are the structures which are of adult size at birth? So let us make a list of those structures also, that structures of adult size. The structures of adult size at birth. The structures which are of adult size at birth, and that includes, number one, that is the tympanic membrane. Number two, middle ear cavity. Number three, that includes auditory tube. Middle ear cavity. Then it includes a mastoid antrum. Mastoid antrum. Cochlea and semicircular canal. Cochlea and semicircular canal. So this tympanic membrane, middle ear cavity, mastoid antrum, cochlea, semicircular canal, and obviously the ear ossicles. Ear ossicles. Malleus incustapes, they are also of adult size at birth. So all these structures, most of them are related to middle ear. They are the one which are of adult size at the time of birth itself. This is also a question which is asked more than once. The structures of adult size at the time of birth. So this is about the systemic embryology of the first part, the head, neck and the face development, with the development of thyroid and the tongue as well, and some important ocular derivatives as well. In the next section, guys, we'll be talking about the GIT and urogenital and the cardiovascular system also.